Secretary General of Médecins Sans Frontières, Krestóffer Lókíér, welcome to النهار. After your visit to Gaza late last March, you spoke about trauma patients and starving kids, but also you recounted some moments of resilience. As an NGO chief who has dealt with so many humanitarian crises around the world, Chris, how do you describe life in Gaza? What does it resemble?
I mean, it's hard to describe it in a nutshell, but you're right. I saw some really horrific things in Gaza. I mean, I saw the Al-Aqsa hospital in the middle area, which was really overwhelmed with patients and struggling with the balance between trauma patients and patients needing care for malnutrition. And at the same time, I saw, some scenes of real joy. I saw a young father with his boy in one of our clinics in Al-Mawasi, who was with him every day, was holding him in his arms as he was receiving new dressings for his badly wounded leg. And it's there's scenes of staff, our teams retraining, relearning how to treat things like malnutrition after being specialists in intensive care, after themselves having displaced many times. So yes, obviously some very, very horrific scenes of trauma, and at the same time some really beautiful scenes of humanity as well, which I think is something that you see in all humanitarian crises. Obviously there are directly those who are affected by the war, the conflict, the very violent trauma, and there are those who die silently because of the lack of healthcare, a real thing that we're seeing in Gaza at the moment, as the health system is gone. There's nothing to speak of from the health system, and so there's a number of people who are dying silently through malnutrition, through diarrhea, through lack of cancer treatment. But what's really, I would say, unique about this particular crisis is that the population is so trapped. The people are so trapped. I mean, they were trapped within Gaza anyway. Large parts of Gaza are no longer accessible. I mean, the north of Gaza is really a siege within a siege. And then we have sort of over 1.5 million people trapped in this tiny sliver of land in Rafah in the south. And and the indiscriminate bombing that we've been seeing in large parts with this trapped population is a really terrifying and graphically horrific.
Does it remind you of anywhere else you have worked before in the world?
I think there are some elements. This humanity, this humanity mixed with violent trauma is something that you see in a number of places. Humans' ability to look after their families, to come together in the most horrific situations. But there's also these huge differences in that people can't flee any further. People can't cross a border here. People can't become refugees in that sense. They're really trapped they were trapped in Gaza anyway, and now a large part of the population is further trapped, which is what I think makes it a particularly horrific humanitarian situation.
Per UN estimates and MSF estimates as well, 1.7 million men, women, and children has been forcibly displaced to Rafah now, and since a ground invasion seems imminent or is looming now, what scenarios do you expect there in this tiny sliver of land? It's not as large as to contain this huge population.
I mean, any scenario that I can imagine is utterly catastrophic and utterly horrific. I mean, we've seen the absolute destruction in areas further north in the Gaza City, in Khan Yunis. Whole neighborhoods have been completely pulverized, and the people in Rafah have fled and displaced many times. And so it's incredibly hard from a programmatic point of view to work out what to do here. I mean, people don't really have anywhere to flee anymore. When I was in Rafah myself, this was just as the fighting around Shifa, the latest round in fighting around the Shifa hospital in the north was starting, and people were being told to evacuate from the north, from the Shifa area, to the Al-Mawasi area where I was staying, and that is such a strange thing in my mind, because firstly, it was very hard for people to make that journey because of IDF checkpoints on the route. They didn't feel safe to come to the south. But then moving to an area which itself is then going to be the victim of a ground offensive, as far as we know, is a really horrific prospect. And the Rafah area is incredibly densely populated. As you drive through, if you drive east to west across Rafah, a journey that used to take 10 minutes now takes an hour, because the streets are so narrowed because of all of the tents and plastic shelters on either side of the streets. So it's not Rafah as it was. It's Rafah with a huge number of hundreds of thousands of displaced people on top of the population, as you say.
You talked about Mawasi region where MSF is based, I guess. There were reports about expanding plans to expand that region. Does it help?
Yes, we have some clinics in the Al Mawasi area. They're clinics which are running a variety of health services, from nutrition screening to treatments of war trauma. But the Al Mawasi area is very inadequate in terms of hosting a population of this size. I mean, if you look at the beach area, where a lot of people have been told to move, there's no infrastructure on the beach. There's no electricity, there's no running water, there's no toilets or latrines. And so we're really compounding a really catastrophic health situation here. And so what we need essentially is for this fighting to stop, and for there to be a sustainable ceasefire from all parties to this conflict.
Does MSF has contingency plans to evacuate hospitals in Rafah in case of a ground invasion?
We're continually
to the Egyptian part of Rafah.
So we're continually assessing our presence. We've been assessing our presence. This is a very, very difficult place to work from a security perspective. I mean, we ourselves have had five staff members tragically killed. And on a daily basis, we're assessing the risks of continuing our operations, the risk to our patients, the risk to our staff. So and we're looking at various scenarios to be able to stay mobile. It's very difficult to provide high quality medical care in a very, very dynamic environment. And MSF, we're used to working in conflict zones. We do it all around the world every day. But being able to plan in this situation is very, very complicated, because we're quite frankly terrified as to what happens if there is a ground offensive.
Is evacuating hospitals is an option?
So we're always trying to be flexible when it comes to our patients, but there's very little places for us to go. So we're looking, we're preparing in case that we have to evacuate hospitals in Rafah, but it's a very hard equation because there's nowhere obvious for us to be able to relocate. We're looking at additional. We're looking at scaling up. We're looking at seeing if we can going back to the Nazir hospital, which is somewhere we had to evacuate back in February. We're looking at the possibility of field hospitals in the middle area near where the Al-Aqsa hospital is. But the really important message here is that field hospitals, they do something for the needs there, but because we've seen the total destruction of the healthcare situation as a whole, this is going to remain a drop in the ocean in terms of the humanitarian needs that are needed that need assistance in Gaza.
With the race against time to avoid such invasion, what is your message to the warring parties?
Really, there needs to be to both warring parties here. There needs to be an immediate and sustained ceasefire. What is happening to the population in Gaza is truly horrific. It's incredibly difficult to provide meaningful humanitarian assistance, and we call on everybody to allow meaningful humanitarian assistance to come into Gaza. This is much more than simply counting trucks crossing the border or airdrops into Gaza. These are small factors when it comes to humanitarian assistance. Humanitarian assistance is being able to get your hands on patients, treat patients with the care that they need, being able to move supplies around the Gaza Strip, being able to sustain working hospitals. And hospitals are more than four walls and a roof. They are running water, electricity, fuel, communications. What's happening in Gaza cannot continue. We have heard that what the International Criminal Court of Justice said on the back of the 26th of January, of measures that they ruled on to prevent genocide. There are two measures there which I think need in particular our attention. Those are those related to the killing of civilians and the scale up of humanitarian assistance. And in my mind, neither of those two measures are being met. We are seeing people indiscriminately killed in huge numbers all across Gaza. We see it in our hospitals, and we're seeing that there is still a huge gap to be able to get to what we consider to be meaningful humanitarian assistance. We're doing what we can. Other aid agencies are doing what they can in a very difficult situation, but we're still seeing thousands of people being killed, and we're seeing people being killed silently through the knock-on consequences of a lack of healthcare. So scale up, yes, but fundamentally there needs to be a ceasefire from both parties here.
Thank you, Christopher. Thank you for your time.
Thank you very much.